At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hi, everybody. Dr. Tom Roselle here. Got a great program for you today, and one that leads into a in-house presentation that we're going to be doing next Wednesday, March the 13th, 6 p.m. at the Roselle Center in Fairfax. And we're going to be talking about migraines and headaches and things that just want to take the top of your head off. This is an important program, important subject, because so many people suffer from these types of conditions. And it's one of the top reasons anybody goes to the hospital to see a doctor, to has other kind of testing done. And we want to take the veil off of that, but more importantly, give you the opportunity to find out how you can take control of your own life, get rid of the symptoms, no matter what they are. And we want to make sure that you understand that. And that's what we're going to be doing this Wednesday evening. Dr. Scott Lamp is going to be with me. We're going to co-present. Just remember, we always have limited spacing. So please call today immediately after the program and register. You can go online at drtomroselle.com or rosellecare.com. That's ROSELLECARE.com. And you'll see it says Migraine and Headaches Lecture, Wednesday, March 13th, 6 p.m. and click the button. And today, immediately after the program, and don't forget, every Sunday after our live program, we go into a live stream, and you're going to be amazed the information that's going to be there. Don't forget today, and we're going to continue the conversation on headaches from a couple of different platforms that you may not have thought about. I think that you're going to find it interesting. And all of our live streams and our podcasts are always available. Go to drtomroselle.com. And if you go to the upper bar on the screen to the right-hand side, you're going to see live stream. And it's on all your social media sites. So don't forget to follow me, whether it's on YouTube or Facebook or Instagram, Rumble, any of those things. We're there. Follow me, and you'll be notified every time that we do a live stream. And we're going to start adding to this and make it even much more interesting for you, so we can bring you the most important information so you can take control of your health and your life, because really that's what it's all about. We're going to approach the subject a little differently today, and kind of waited till the end process, if you will, to find out that most headaches, regardless of what they are, come from two things. It comes from a misalignment of the spinal column and inflammatory reactions within the vessels or the spinal fluid area that feeds the brain and affects those areas. Now, so we're going to talk about spinal misalignment, particularly misalignment of the neck, and how the nerves get irritated as they go through this region. You have 31 pairs of nerves that come off the spinal cord, but 8 of them are in the neck. And you have the cranial nerves as well. There's 12 of those guys. And they can all have problems causing pain. So anything that causes a mild restriction and irritation, a pull or pressure on these nerves can cause a problem. Anything that affects the blood supply to the brain because of the misalignment can cause pain. So when you look at a pain pattern, you have to look at things like dizziness and generalized muscle pain. But a lot of that gets finger pointing to the structural system called your spine. And so in most cases, headaches or migraines are a result of this. And when the vertebrae, the bones of your neck, are out of position, and we're talking about millimetric misalignment, and sometimes reversing the spinal curvatures, sometimes causing degenerative changes and so forth, all of a sudden your body can't handle it anymore, and it begins to produce these symptoms. And by the way, when you have a headache, it may be the last piece, if you will, the straw that broke the camel's back. And before that, you had some back pain. Before that, you had difficulty sleeping. Before that, you just had neck and shoulder tightness and stiffness. Before that, you're beginning to lose focus with your eyes. You can't see quite as well as you used to. And some days it's a little better, and some days it gets really bad. That's because of the muscle contraction that occurs at the back, the base of your head and neck, causing irritation to the spinal cord, but also to the nerves that go to the eye. So what it's telling you that these misalignments can begin to build up, be insidious over a long period of time. They're quiet at first. It's like somebody that ends up with cancer or ends up with a heart attack. You don't know that there's a problem until sometimes it's the end stage. It's too late. Somebody has a heart attack, but that clogging of the artery, that irritation to the cardiac tissue came about slowly over a period of time. That irritation that caused the cellular breakdown of tissue in your body called cancer isn't discovered until, oh my God, what's this obstruction that's there, or this pain that just doesn't go away, or this bleeding that occurs. Headaches and migraines are just like that. And when you have a misalignment of the vertebral segments, the vertebrae, the bones of your neck, they can trigger migraines that most traditional physicians don't know where they're coming from, because they don't give the significance, the credence, if you will, to the postural relationship between what happens with the symptom process portraying itself and the underlying triggering mechanism that began to come about over a period of time. So let's talk about what causes it. What's the underlying process that may contribute to these headaches, these migraines, when it comes from a structural problem? So have you ever watched yourself walk? It's really interesting. You should have somebody get a camera, your cell phone, and record you as you're walking forward and as you're walking backwards. Remember, it's for your eyes only. And look at you from the side, look at you from, all angles, and see if you're standing straight. That means that just slightly your earlobes should be over your shoulders should be over your hips, and your hips should be over your ankle bones. And it should be a nice, easy, straight line. If that's not the case, if your head's leaning forward, if it's tilting off to one side or the other, if it's slightly rotated in one area or another, or a combination of those things, or your body, like a pendulum, has gone forward and got stuck there, those are signs that your structural system is not doing what it's supposed to be doing. Now, on Wednesday night, on the 13th, we're going to demonstrate what happens. We're going to show you the pain patterns that occur. In today's world, we have something called tech neck. And that means that so many of us are on our cell phones all the time. We're on our laptops all the time. We're looking down, and it causes a reversal, a change in the normal curvature of the neck. It puts pressure on the back of the head. You go in, you grab somebody's shoulders, and they'll kind of yelp a little bit because it's too sore. And all of a sudden you change the posture, and that goes away. Do you stand with your feet shoulder width? If not, you're going to have pain and pressure in your neck and shoulders. Do you walk with your chest, the middle of your chest up, like somebody's got a string in the middle of your breastbone and it's pulling it to the ceiling, not pulling your shoulders up or back, just bringing your chest up, and walk that way? You'll find just doing that will make a huge difference. When you're walking, you have a little bit of swagger, you have a little bit of motion in your shoulders. If not, your spinal cord is being irritated because there's no motion that allows it to do what it's supposed to be doing naturally. We're going to show you that. I'm going to really point out what the problems are as they begin to build over a period of time. But that upper portion of your neck, the cervical spine, the first two vertebrae, they're called Atlas. That's the guy that used to hold up the world, right? And Axis, that's the second vertebrae that the top one pivots around. And by the way, it's the only vertebrae or vertebral segments, cervical 1 and cervical 2, that does not have a disc space in between them. And so that can be compromised even more. So we want to find out what the deal is with these things, why your headaches are there. And we're going to point that out very specifically. But more important, we're going to give you some things to do. We're going to give you some exercise. We're going to show you what to do. We're going to show you what to, to look for. But when you really begin to break it down and you look at the reason that these things come about, you begin to see that the disrelationship, if you will, of the vertebrae are very key in not only predicting the pain that may come about, but also must be treated to be able to resolve it 100%, to get rid of all of those things. Did you ever notice that, sometimes you get outside in a really, really hot summer day in the middle of Virginia and the sun is bright and there's, your eyes really, really hurt and you'd like those sunglasses? Often that's because the upper portion of your neck, cervical 1, Atlas, cervical 2, Axis, are not positioned properly, and they're putting pressure on the nerves that service your eyes. Interesting, right? But that's really the way it takes place. So things like bright lights hurting you, or, you're sitting around, poor vision screens. What I mean by that is this blue, the blue light coming off your screens are very difficult to your eyes. They damage tissue. They cause the neck muscles to contract, and that contraction now causes the nerves to be irritated, and now you have a headache. You ever have a sinus headache, frontal pain that just doesn't go away? Can't figure out what it is. You're taking all kinds of, nose dope. You're taking all kinds of things that decrease the inflammatory reactions. Well, guess where that's coming from? That also can come very straightforward by the vertebral segments of your neck not being aligned properly. So we want to make sure that you get it, and when I say get it, I mean understanding what this really is. It just didn't show up. Everybody thinks that, when they have a headache or they have any kind of pressure that just doesn't go away, that the horses have stayed in the shop and now you got zebras running around, and they're the oddballs. They're not the things that really show up all the time. They're very, very rare. It's like a brain tumor. It's very rare. We'll tell you what the indicators are that on Wednesday evening. We'll tell you exactly what to look for. And they're very specific in their presentation. If you got a real problem, the red flags can be anything from loss of sensory function, or your vision suddenly, changes dramatically. You're getting prolonged or repetitive vomiting. That's an indicator. So what we're talking about is rare situations that cause it. Does it happen on a rare situation? Yes, occasionally. But listen, the huge greatest proportion, over 95% to 97% of the time, is something that can be identified. It's straightforward. And, wouldn't it be great to get off of these aspirins and, the alcohol, anti-inflammatories, the things that, kind of put it down to a livable level, but you got to stay on them. Otherwise they never go away. Well, here's an opportunity. Let's see what we can do to put you in that position and make a difference relative to, your life. You get rid of that headache, your head's clear. You get rid of that headache, you feel like doing things. You get rid of that headache, and, you can actually have a conversation with somebody, read a book, and remember what she discussed. And unfortunately, it takes all of that. And it costs millions and millions of dollars annually, both in the loss of income to the person who's got the headache, but also to the job and society and production. So you want to contribute, let's get rid of the headache, and we're going to show you how to do that this coming Wednesday evening. We're going to touch upon identification of where it's coming from with a very simple tool. It's called thermographic imaging. If those of you who've listened to last week's live stream, you understand that if there is a vascular headache, which i.e. is a migraine, or even problems with the alignment of the neck, there's going to be an increased heat pattern in most cases. And we can pinpoint where it's coming from, in addition to using x-rays and other elements of diagnostics, a good neurological exam, a good structural exam, looking at the biochemical pathways, knowing what's irritating it, the inflammation that be caused because you're not eating the way you're supposed to. But all of those things are critical in making a true diagnosis. And if you can't make a true diagnosis, you can't fix anything. And that's the piece that I want you to remember. Identification of a problem accurately, specifically relative to where it came from and what's triggering it. So even though we came from the back of the neck, the next thing that we need to know is what caused it. Is it a biochemical reflex association to that area? Was it trauma that the body's remembered over time, an injury pattern that's embedded in the bone or in the tissue? Is it a stress pattern that we're on, or a combination of those things? Did you go to the dentist and have some work done where the vertical dimension of that TMD, that temporomandibular joint dysfunction now is causing the cranial plates? Remember we said there's 22 of them that no longer move the way they're supposed to move. And if that's the case, guess what? You're going to need some help, but you got to identify that that's what it really is. Think back, roll the clock back. Ask yourself the question, when was the first time that I started having a problem with my head hurting like this? When was the first time that I had a problem with my eyes not being able to focus? When was the first time that I get this headache and my hearing becomes, way too sharp so everything bothers you, or you can't hear at all? All those things can be parallel and consistent with headache problems. And we have to look at the things that are triggering it. We got to look at, again, has there been an injury pattern that goes back years ago? Was there an accident? Did you play sports? Did you get hit in the head with something? Did you fall and bump your head, repetitively sometimes on your trunk of your car? I've done it a few times. It doesn't feel good. It does hurt. And how about at home? You suddenly do something. There's an underlying trigger that most people don't even think about. How many of you, when you're sitting on the sofa or your favorite chair and you're reading, you're watching the stupid tube, as I call it, and suddenly you're getting sleepy and your head drops forward hard, fast on your chest and say, oh, that hurt my neck? Well, if you do that, that's like a whiplash. And whiplashes can cause the nerves to be overstretched. Whiplashes can cause pressure on the cord. Whiplashes can cause inflammation and problems on an ongoing basis. How about car accidents, since we're talking about whiplashes? How many of you have been in any kind of a little bit of fender bender? You know what the worst ones are? The ones that somebody taps you from behind at about 12 to 15 miles an hour. The reason that they're so significant at that level, because most of you say, that's not a big deal. Well, let me tell you what happens. When you get hit from behind, your head is going to ricochet backwards. And then why it's called a whiplash? Because when the motion forward stops, that pulls your head back, now you're going to recoil in the direction of the push of the car behind you, which means you're going to go forward. So you're going to go back and you're going to go forward, and then you have a whipping action. The problem is this. If you were hit a little faster, your car would probably crumble some, and you wouldn't have as much linear pressure that would hit your spine. So when you hit it about 12 miles an hour or 13 or 15 miles an hour, there's often very little damage to the vehicle because the car is meant to collapse, if you will, under pressure at a certain speed. But now that energy, that linear energy, continues uninterrupted. It goes to your back, crawls up your spine, and about the time it gets to the top of your head, sometimes it's at 5 gravitational units of pressure. Now, let me give you a relationship of what that means. A fighter pilot will pass out at 6. if he doesn't have any balancing, any compartmentalized, repressurized suits, right? So that's what happens, is that you don't have that protection. But at 6 gravitational units that suddenly occur, and that's what occurs in a car accident, now you got a problem. But it's at 5, so it's going to affect your spine. It's going to affect the muscles. They're going to contract. You have a problem that you don't know where it came from, but it's sitting there. So what we want to do is find out, you got a problem. We're going to show you how to make that determination. We're going to find out if, you turn your head to the right, to the left, all of a sudden you get dizzy and that headache gets a little worse than it should. We're going to find out if sound causes muscle reactions, mostly weakness. And we're going to find out how long it takes your body to recuperate. All those things are associated with any kind of ongoing chronic head pain. And we're going to do that this Wednesday evening, the 13th at 6 p.m. at the Roselle Center for Healing. Make sure you register today. Simply go online, go to drtomroselle.com or go to rosellecare.com. Either way, you'll be able to register for the class. At Roselle Care, you're going to scroll down. You're going to see migraines and headaches. You're going to hit the button that says register now. And we're going to have some fun doing it, as we always do with our programs. I'm going to show you. I'm going to demonstrate. Dr. Scott and I will go back and forth. And many of you know Dr. Scott. He's amazing wealth of information, tremendous capacity. And it's just a pleasure having him around all the time, because we both feed off of each other. And I think you're going to enjoy the evening. It's going to be really over the top. Let's talk a little bit more about these triggers, right? Got into the dental field, and I want to stress that a little bit more, because sometimes we don't realize how significant the alignment of the jaw and the temporomandibular joint are. And what I mean by that is simply this. When you close and open your mouth, you're going to go in the mirror, just open and close slowly. Do you get a deviation of your jaw to one side or the other? Does your jaw come forward? Do you try to find neutral? All of those things suggest that you may have a misalignment that may be due to teeth being too high or too low, because you had a dentist, and they're not bad guys, and please don't think that they are, but most dentists align the jaw, think about it, when you're lying on your back in about a 40-degree angle. So what they do is they do whatever they're going to do. They put that little carbon paper in, they go clamp down, grind, go back and forth and so forth to try to find position. But that's not the way you live. How you live is in a standing or seated position. We are bipeds. We walk on 2 feet. We don't lie on our backs, only when we go to sleep at night. Don't forget to join me this Wednesday evening, March 13th, and join me immediately after the program for our live stream. Don't go away. Just click in and let's go there. Remember, I continue to do this for one reason only. I love you all. I'll see you in a few minutes on live. Don't go away.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Migraines and Headaches on Wednesday, March 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.